professional of public health and as a researcher, to if in the African community, especially where we come from, what do you think is the predominant challenge health-wise, and what is your advice and suggestion for either managing such situations or getting out of those situations or preventing such situations?
To be honest with you, Mr. Chinedu, that question is, if the Minister of Health in our country can answer that question alone, we would have solutions to our problem. But I'm going to answer it as much as I can. And if we are truly sincere with ourselves, we would know that our health in the system is driven by major factors, which are not really health in quotes. So how do we look at this in public health? We call them the determinants of health. It could be social determinants of health, right? So if an individual is poor, living in a poor neighborhood, does not have shelter over his head, does not have good water to drink, does not have good roads to drive on or ride on, does not have appropriate environment in terms of maybe there's fog, smoke, or the air quality is poor, all these things come together and affect the health of the individual, right? So if the community is in good state, more than likely, everyone will be healthier. So how do we solve the problem? In Nigeria, the state of Nigeria right now is really, really critical. I'll put it this way. I'm not going into politics, but we know that the situation in the country is very dicey, it's poor. And I mentioned this because it plays out in other things and it plays out in healthcare. Look at it. For over the years, cholera has been a minor problem in Nigeria. I will say minor carefully because there are some states who are still having a problem, but it has been a minor problem in Nigeria. But just this year, we had an outbreak. Why is that? Because what drives health is not just hospital alone. It comes from the community. It comes from what you are eating. It comes from what you are drinking. It comes from what you are touching, where you are walking through, where you are sleeping. So cholera outbreak will be experienced if the socioeconomic situation gets bad or poorer. If people cannot afford to throw away food that is not in good condition, if people cannot afford better drinking water, if people cannot afford to even get gas to cook or warm up their food before they eat it, or people cannot get clean water to wash or bathe, they have to drink from the dirty sources. And people are going to all form of shady businesses to make money because they think they can just do it, right? But what I'm saying is this: all these things put together drives health. So the wealth of the nation is intricately connected to the healthcare, because what you eat, what you drink, is going to affect how you look, how you live, like your day-to-day things. I will give you an example outside of Nigeria. There's a country we all know, Haiti. It's in Central America. 2010, they had an earthquake. Haiti was okay. For more than 100 years, there was no cholera in Haiti at all. But in 2010, they had an earthquake. And after the earthquake, there was also a hurricane. Within that period, there was an outbreak of cholera. Although the source of the cholera was being disputed between whether it was locally transmitted or brought in by UN agencies who came from Nepal. But at the end of the day, there was cholera outbreak and it was massive. And it has been lingering in that country ever since with the whole economic situation. So that's how it plays. So if Nigeria really want to solve healthcare problem, reduce the malaria burden, remove cholera, reduce epidemic of diabetes, hypertension, and all of that non-communicable diseases, as well as the communicable diseases which I've mentioned, some of them right now, we have to look at how is the living conditions of every individual in that country. How are we looking at housing system and estate systems? How are we looking at the road system to avoid people getting into accidents when they are not supposed to? You cannot travel for 30 minutes without falling into different potholes. So those are the things that affect. Because if you look at statistics, you see that there are a lot of persons who are out there, they are healthy normally, they are able to manage, but suddenly they get into an accident and die. All these things also count in public health mortality rate. How about our mothers, pregnant women, children? We also have to look at it. How many midwives do we have? How many are we employing meaningfully to work? How many nurses are we employing meaningfully to work? Those are all factors across. And okay, actually, I can continue talking from now to tomorrow about this issue. We have to look back. We have to look at the structure. We have to look at the policies. We have to look at the density of hospitals around the communities. We have to look at the density of health workers around the community. Last research I was looking at, what I saw was for Nigeria, 1,000 individuals will only have 19.5, although there is no fraction in humans, 19.5 healthcare workers against, that's 10,000, sorry, not 1,000. And that is totally like to the lowest, the barest minimum as to the standard that is supposed to bring proper healthcare to the people. So if we keep doing it this way, we'll keep having problems. I'll call on the government, I'll call on the Ministry of Health, I'll call on everybody. If there are interventions at the top level, then we should look at a way to see it through. But I will talk about this again. Let me just give you time. Maybe you have some other questions to ask, and we don't have so much time.
Okay, yeah, thank you. I just want to bring out some of the, let me say, striking points of what you may discuss or we anchor on, because I know that you cannot talk of health system without referring to the factors that are of high, let me say, high percentage of influence or contribution.
Yeah.
One of them is the ecological factor, that's the environmental factor, and one of them is the economic factor. So there's no way, just like you intelligently presented here, there's no way all those things will start moving well where the economy is bad, is harsh. People don't even have access to proper Medicare, and the environment doesn't look. Environment is not in consonance with what healthcare demands, or what the kind of sane environment that is habitable